Around 18 weeks, I started feeling pressure that I felt was abnormal for 18 weeks especially, and I went to get checked, and that's when they had found it. Prior to this pregnancy, never heard or seen anything at all about placenta accreta.
Placenta accreta spectrum is a disorder where the placenta abnormally attaches within the wall of the uterus. It often has no symptoms whatsoever. Sometimes a patient may have some vaginal bleeding throughout pregnancy, but often it's a diagnosis that's made by an ultrasound. We found out from other centers that these patients were getting sent to other states, specifically Indiana and Ohio, because there weren't complex teams set up to manage these patients. We really started from the ground up. We found specialized GYN surgeons who were experts in the care of hysterectomies. We, as maternal fetal medicine doctors, took over the prenatal care for these patients, and we also worked with our anesthesia teams and critical care teams to ensure that if there were complications, that the hospital was ready to manage these patients effectively.
My doctor got together with the people she felt were the best in the state to take care of me in the situation, and that's how I ended up at UofL. I'm very happy that I had a doctor that was confident enough in herself to say, I can't do this for you, but I know people that can.
We have sonographers that are trained to look for abnormalities that can be seen in these cases. So then you meet with an MFM physician who will sit down and review the ultrasound findings with you. In some cases, we may order an MRI for surgical planning if we do have concern that the placenta is growing into other organs. Lastly, we talk about delivery planning and timing and what that procedure looks like. All of our patients will have consultations with our anesthesia care service as well as with our neonatology service. The last step that happens behind the scenes is we have a multidisciplinary meeting with all of these teams to discuss the cases to ensure that we have everything prepared for the day of surgery, and we plan for the best case scenario as well as the worst case scenario.
I felt very, very protected by them. I felt very calm. Even up to the day of my surgery, I was very, very calm about everything.
Our goal at the end of the day is to have a healthy mama that makes it through surgery without complications. Oftentimes these mothers do need blood transfusions and longer hospital stays. Most of the infants also require some time in the neonatology unit. We've had dozens of patients over the past year that have gone home with their baby and are doing great.
We are doing amazing. Leo is so big, so beautiful, so charismatic, and he's just so healthy. My healing process and the support and care, of course, I got throughout UofL and therapy and everything has just really made a world's difference in my life. So I'm very, very lucky and blessed that we are both doing so well.